very lightly.
The previous programs in this series illustrated detailed assessment of the various body systems.
Good morning, Mr. Anderson.
Good morning.
How are you?
Okay, thank you.
My name is
In this
Jenny.
program, we will put it all together in the form of an overall initial head-to-toe assessment that would be utilized when admitting a new patient to either inpatient or outpatient care.
So do you have any problems or issues that we need to talk about today?
None come to mind.
Okay. So why don't you tell me a little bit about yourself?
Male and female reproductive and breast assessment will not be included, as these are specialty exams, and they have been fully covered in other programs in this series. As in the systems-based assessment, begin by taking a medical history, including previous health problems, current conditions and concerns, and medications.
Currently, I have asthma and allergies.
Okay.
And a bit of moderate pain. It's continuous, but
All right.
nothing unmanageable.
Okay. How about any history of health problems, medical problems, surgeries?
I've had a craniotomy.
As you gather the history, also note if the patient appears to be the stated age, exhibits normal or impaired level of consciousness, and whether or not he appears appropriately nourished.
Okay. How about any history of health problems, medical problems, surgeries?
I've had a craniotomy for the removal of a meningioma in '84. I had
Also note his ability to communicate appropriately and effectively.
Habitando, pero estaba muy pesada la basura y es cuando me lastimé la rodilla.
He did not fall, he was walking.
If the person speaks a different language, make arrangements for interpreter services. Finally, note the patient's level of personal hygiene as an indication of his ability to provide for his own care needs.
So I'm going to give you a gown, and I'm going to step out of the room, and you can remove everything except your underwear, put on the gown, and then we'll finish with the exam.
Okay.
Okay, thank you.
Thank you.
I'll be back in a few minutes.
Okay, thanks.
So we're going to go ahead and start with a height and a weight and a waist circumference. So if you want to
Okay.
kind of come down off the table,
Okay.
and we'll get that.
Once the patient is ready, begin by taking basic height, weight, and circumference measurements. These measurements allow the nurse to calculate the patient's body mass index. Vital signs, pulse and blood pressure, are taken next, and if the patient has been seen before, compared with previous readings. It is important to take and record the blood pressure reading on both arms, as a significant variance can indicate circulatory problems. Once the basic measurements and vital signs have been taken, the assessment begins with the patient's head and proceeds to his toes, as the phrase head to toe implies.
Okay, so I'm going to be just looking at every system. I'm going to start with your hands, and as we go, I'm going to check your skin.
During this process, examine the patient's skin at each step of the assessment.
Again, it looks like you work with your hands here. Okay, now I'm going to go ahead and look at your skin, your head, and your face. So bend your head toward me.